healthcare systems. Now this is the fucking, pardon me, excuse that, while I smoke a cigarette, but there are two healthcare systems in the nation: private healthcare and federally mandated healthcare. Federally mandated healthcare is Medicare and Medicaid systems, and under those systems, other systems like those dealing with social issues use that information in order to decide to build a hospital, decide to build an outpatient care center, decide to fund for Medicare and Medicaid related services, which is a good healthcare system. So we wrote software. My business group within the federal government, almost, we were contracted directly through the states with federal money. This is the Affordable Care Act. Billions of those dollars went into IT systems, disparate IT systems, very broken IT systems because of individual state rules. So in my case, I supervised professional developers doing systems inside of these systems across 11 U.S. states. We helped integrate, define, and make the applications that Medicare and Medicaid and even some of the VA hospitals administrations uses. It is approximately 1/3 of the healthcare information for the United States population that resides in that database. It is very deep because it includes child care services. They get to see where that money goes. They get to see what the diagnosis was. They get to audit and oversee how the work is performed in requirements that they can keep to. The other side of that, and this was the other side of our corporation's business inside healthcare, is corporate healthcare, Medicaid and Medicaid systems. We had two separate divisions with hundreds, even thousands of people in them, because we supply services from the person picking up a telephone in centers all the way out to the data centers, building the data centers for these systems, trying to get in the door to those data centers to sell more goods and services, because that's what we do as professionals, offering ways to make other businesses better and getting our foot into the door. In this case, it is federal governments. It is that little hospital down the street that has a computer system. Well, if you're in Medicare and Medicaid insurance, they have to have access to that piece of the business through one way or another. It's a federal requirement. So now you have inter-systems communications across every hospital in your neighborhood, across every hospital in your state as a requirement. Yeah, rules, like putting a mask on to help save something, to help do things better. This is what we're supposed to be doing. So inside of this, your boss owning your health care, your boss getting to decide if you get birth control. If you can't get birth control, then the dude better not be able to get boner pills, because you know what men do with boner pills? Pull that picture up. So, for some reason, we've allowed non-related entities to second-guess professional entities. But back to healthcare data. This healthcare data is huge. Next time you're at the doctor's office, ask him how far back in your medical history they can see. He will become embarrassed. He will say they're waiting on some records from somewhere. Or he'll say, well, they've only got what you've done while you're here. If that's the answer, then they aren't paying for some services that they need to get the rest of the data, because that's how it works. It's buried in some old mineshaft repository run by some place called Iron Mountain. It's buried in a language, in a structure so archaic it's going to take months for some engineers to re-engineer what engineers already engineered. But the equipment's gone. The hardware to do it is gone. And even this part of it is gone. So, healthcare systems, universal healthcare. You know what we would save in IT? That word, IT. That word, AI. It is truly amazing. I can think of thousands of jobs out there towards doing that, and few of them involve somebody with yachts and motorboats. They're scared, they're unnecessary and redundant if you look too close. Let's fix tax laws, too.